So, Kerry.
Yes.
IUDs. We're on the topic of IUDs.
Yeah.
Okay. Why did the club hire the IUD?
I have no idea, Dr. Scott. Why?
Because it kicks out unwanted guests. Dun, 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 dun.
This is STIRRUPS, Candid Conversations in Women's Health, the podcast where we answer your burning questions and discuss the evolution of women's health through every stage of life. Join Dr. Randolph Scott and duly certified women's health nurse practitioner and certified nurse midwife, Kerry Autry, as they discuss the unique health concerns women face and share expert advice to assist you on your journey to maintaining your health and wellness. If you're looking for informative discussions, tips from qualified professionals, and a community dedicated to women's well-being, then you're in the right place.
All right. And so our first podcast subject matter will be the ABCs of IUDs. Okay. IUDs. IUDs, they stand for intrauterine devices. And there's a lot of information, a lot of myths, and we're here to dispel some of those. And so I'll let Kerry kick off our first question. And that first question is...
why don't we start with what is an IUD?
Okay, that's not even on here, but
what is
works.
An IUD? We talk about them a lot. We throw around the word a lot, and people come in here and there's all kinds of misconceptions about them, but it's a tool that we use in women's health all the time because it has so many incredible benefits.
Okay.
So you said that it's really an intrauterine device, which means it is a small plastic, sometimes metal device, depending on which type we're talking about, that goes inside the uterus and stays inside the uterus for a number of years at a time, depending on which type you're looking at.
That's fantastic. The IUD is really for one or two purposes. Either it is used for birth control, or it's really a tool to help manage bleeding concerns that patients will have. And so depending on where you fall, it might be a little bit of both. And so IUDs are a great tool. They are almost as effective as having your tubes tied, but provide you with long-term contraception. And then, of course, the secondary effect, depending on which IUD you choose, will also help manage some bleeding concerns that you have. And so now, getting into the IUDs, there's a lot of questions that patients will have regarding the IUD. And I think one of them is, will the IUD protect against sexually transmitted infections? And so the IUD, just to kind of think about it, really is a barrier. It prevents really egg and sperm from coming together, but it does not in any shape or form really protect against anything that's problematic in terms of any sexually transmitted infections. So as a provider, we always relay that to our patients that certainly it's mindless, but you want to have the mindful thought of making sure you're protected in any circumstance that deems necessary for you.
All right. So our next question, Dr. Scott, is how soon is the IUD effective after you place it?
Woo.
I
know.
It's really important.
So I'll start with the types of IUDs that you have. And depending on the IUD itself, determines the effectiveness of the IUD. So there's really only two types of IUDs, and there are different IUDs that fall within that category. The two types are either it's hormonal or non-hormonal, okay? And Kerry, I'll go over the aspect of the hormonal IUD. The hormonal IUD really is effective after about a week in terms of placement, okay? And so that means that you can be confident about any sexual experience about a week after it is placed, to the point where you can say, all right, it's a safe area for me. And copper IUD?
Copper IUD is a little bit different. Copper IUDs are officially effective from the moment we put them in. I usually warn patients just to use a form of backup for 7 days to be on the safe side. Once you've gone through the process of insertion, you really, really want to make sure it works.
Now, insertion. That's the TikTok question of the day. How painful would it be to have it inserted? And what do you do if there are painful circumstances during the course of your insertion? And so there are a variety of options that you can have. And we want to make sure the public knows that you can have pain medication for your IUD insertion. Now, it's a little caveat to that because if you have a great provider, that provider should be able to put that IUD in within a few minutes. And so it is not necessarily an easy circumstance, but if you can put it in with a few minutes, a lot of times, a lot of those pain considerations are not necessary for you. But there is the aspect of almost, as I place the IUD, I do a little bit of a test, meaning in order for you to have an IUD placed, not every uterus is the same shape and the same size. And you have to figure that out before you actually place the IUD so that it is placed properly for you. And during that assessment of figuring out how big the uterus is, you can determine what the patient's pain tolerance is. If the pain tolerance is excessive to the point where you don't think you're going to be able to put this in comfortably after your test, then it might be a good time to pause and rethink how you actually manage the patient in terms of insertion. So some patients will have what's called a paracervical block. That means that you actually give anesthesia, but oftentimes, and I'm sure, Kerry, you've experienced this. Mm-hmm. What's the big deal about the paracervical block?
Well, they're hard to do. Mm-hmm. It takes a while to get it done. And often by the time I would have done a paracervical block, I could have had the IUD and have been done.
That's correct.
So we've put the patient through more discomfort than we really needed to and extended that time period of discomfort longer than we needed to.
That's right. So sometimes it's catch-22. You put it in, and if you can do it efficiently and if you can avoid the paracervical block, then oftentimes it's helpful for the patient. But if necessary, that is an option. Mm-hmm. But it is a needle, and it is a needle to a sensitive area that will help you guide you through the process of the insertion. The other aspect of it is that we can take a complete step back, and oftentimes what's necessary is to tell the patient that I understand. I get trying to put this in is not necessarily easy. I've never had to have one put in myself, okay? But I certainly have put in many of them, and there are other options in that regard. And so what are some of the things that you do in terms of pain management for the IUD once it's placed?
It depends. I was going to say, it depends on the patient. Unfortunately, it is not impossible, but it's more challenging to have placed for a person who has not had a baby yet. That it's just a little bit tougher for us to get through the cervix. It's a little bit more uncomfortable for the patient. So for those patients, I will usually, I always pre-treat all of my patients with a darn good dose of ibuprofen, have them take that about an hour before they come in. And then if they have not had a baby or I'm expecting it to be a little bit more complicated, I do usually give a medication to just soften the cervix before they come in. Sometimes even like anxiety can be contributing to our challenge with getting them in, because if patients are so anxious, just everything is tighter. Sure, so sometimes I even give a medication to help with the anxiety, because that can often make it much more comfortable for the patient.
Well, you know what, Kerry? We practice very similarly. Okay. So no, that's good.
And then afterwards, I always tell patients to take the ibuprofen for 2 days.
Yeah.
Just take it breakfast, lunch, and dinner for 2 days. After that, see if you need it. But usually that's enough.
I think that's a great plan because it really gets to the aspect of meeting the need, but also not letting the patient's height of their pain become a problem for them. So another additional couple of doses at home probably would serve them well if there's going to be anything problematic from insertion.
Right.
Okay. All right. Now, next question up. Kerry?
All right. So our next question that we got from our patients, and one that I hear all the time, is what are signs that the IUD is not in the right place?
Uh-oh.
Yeah. It's one of the things that I think people dread the most, that they get this IUD placed. And because if you look on TikTok, they just fall out of people all the time, all the time. I don't see that very often. I don't know about you, but
I don't see it very often. No.
Occasionally they do become misplaced, but it's a rare occasion that they become misplaced. But there are definitely some symptoms. It's not the type of thing that you wouldn't notice. So what are patients telling you?
Misplacement, there is actually two varieties of the misplacement. And so one of them is something that is actually more complicating, and that is the perforation. Now, that means that you've inserted the IUD and it was inserted at an improper place at the time of the placement. And then the secondary aspect of things is that there is a migration that sometimes the IUD will shift downwards, even to the point where it shoots out sometimes, and that's called an expulsion. So the migration of the IUD is one thing. That is certainly of a natural phenomenon.
Does happen.
That happens, even though the IUD in itself is a T-shaped device and is supposed to anchor down in the sense of its placement, it still can migrate downwards in that regard. And so those things are problematic. The biggest one, though, is the actual perforation. The perforation is the scariest aspect.
But that happens at the time of insertion. That's not something that would happen later.
Absolutely.
So anybody who's having an IUD placed is going to know that happened in that moment. It's not something that happens 3 days after.
That is correct. And so I have often heard that, the IUD migrated from the uterus down through the tube, and now it's someplace else.
Right.
No, that does not happen.
No.
Okay, we can dispel that myth. It does not migrate through the tube and into the abdomen. So it is one of those things that happens at the time of. And so to mitigate that, we here practice in a way that we want to reassure ourselves of the placement, even though you're very confident about where things are. We perform ultrasounds.
We do.
Just to make sure IUD is in its proper place and that there are no issues or concerns with the placement itself. And so that's how you
all the time. I'm like, you and I are both going to be able to sleep better tonight if we know this is where it belongs.
Right. And easy enough. And so, so the ultrasound can help mitigate some of that for us. Okay. All right. Also, this one, I'm sorry, Kerry, I'm going to punt to you. This next one, I'm not qualified to answer this question. So
I already know where you're going. Go ahead.
All right. The next question is, can I gain weight after IUD placement?
Weight gain is a risk with all hormonal birth control. So when we're talking about weight gain, we're talking more about the hormonal birth controls as opposed to the Paragard, which is the one IUD that does not have any hormones. We don't see weight gain with Paragard IUDs. With the ones with hormones, they have a little bit of progesterone. Progesterone can cause a little bit of bloating. It's usually more bloating than weight gain per se. But there are those people out there that occasionally gain a couple pounds on an IUD. Of the types of hormonal birth control that I use, it's not one of the biggest offenders when it comes to weight gain. There are definitely some forms out there that are significantly worse when it comes to weight gain, but it's not unheard of.
Yeah, and that's my take on it.
Yeah,
exactly. My sentiments exactly.
Yeah, I warn people, it's usually one of two things. It's either bloating, so like you got to up your water intake, or cravings. And, if you know the cravings are coming from the IUD and you start to pay attention to it, you can kind of watch it there.
Subdue it a little bit. Okay. Fair enough. Yes. Great answer, Kerry. And so the next question is, how do I know if I need to take the IUD out as I near menopause?
See, that's where I thought you were going last time.
Man, that's a good one, Kerry. No, but yes, Kerry, you can answer all of these questions, okay? But when do you take it out? So the IUD, really, when you take it out, sometimes is, even for a provider, hard to really tell the patient that it needs to come on out. Now, we do know you take it out at the end of its expiration.
Yep.
But that doesn't mean that you can't even take it out earlier than the expiration, depending on the needs of the patient. So For most varieties that we place, there are several different IUDs. There's a 3-year IUD, there's a 5-year IUD, there's an 8-year IUD, and there's a 10-year IUD. So at the expiration, you can decide whether you want it taken out or if you want it replaced. And so that's easy enough. But the other circumstances, as you get older, you're trying to figure out, are you menopausal, which means that you stop having periods, and particularly if you had your IUD placed to help manage some of your cycles. If you take it out prematurely, then it becomes problematic with the aspect of the bleeding if you had it placed because of bleeding concerns. So it's not a set really way to figure that out. Most providers will go with the law of average. The average woman will go through menopause at age 51 or 52. Yeah. Given that circumstance, if you're in that ballpark and you still have your IUD, then I think it's worth considering in terms of having it removed and seeing what things would be like afterwards for you. So.
Yeah, I usually leave them. Like, how many more years have you got on this? 3 more years? Let's just leave it for another 3. If it's not bothering people, IUDs are such a good tool in perimenopause and menopause because, as you know, Dr. Scott, like one of the biggest symptoms that come with perimenopause is really unpredictable, but often very, very heavy, very uncomfortable bleeding. So IUDs are one of the biggest tools I use to manage perimenopause and menopause. So if, I'm helping a patient who's say 51, 52, but I've got another 3 or 4 years on her IUD, if it's not bothering her, very often I'll just leave it. The other really good thing about IUDs in that stage is that a lot of times if we're using hormone replacement, I need some sort of progesterone, and that IUD is working as part of my hormone replacement. So IUDs are actually an incredible tool for perimenopause all the way through that period into the menopausal period. So I use them. I usually leave them.
Yeah, I love it. Okay. All right. Everybody keeps their IUDs now.
Yeah.
Okay.
As long as you can keep it.
Yeah. And so, but you're right. If it's not expired, certainly you want to help manage the individual regarding some of the concerns that they may have. And for those perimenopausal patients, you're right. And those patients who are menopausal, who you're considering hormone replacement therapy, meaning that you are giving some estrogen, the IUD can help protect you against the estrogen that you're giving, because estrogen, when you're postmenopausal, can be stimulating in an untoward way for you. So I agree with you. Keeping it in is probably not a bad deal even after age 51 or 52. Yeah.
All right. We talked about this a little bit, but we didn't really touch on it directly when we talked about the different types of IUDs. What is the difference between IUDs with hormones and without?
There is a subset of patients that are extremely sensitive to hormone, and the hormone can be problematic, for some patients. But the hormonal IUD, the reason why most patients don't experience any symptoms because it's localized hormone. It's not anything what we consider to be systemic, and that means that you're taking a tablet, it goes throughout your body and becomes problematic. Because the IUD is inserted inside the uterus and is providing hormone to that local area, it doesn't have the same impact as if you were taking birth control pills.
Agreed.
And so, the aspect of the IUD from a hormonal standpoint usually, again, doesn't impact patients to a greater extent. But for some patients, it does. And some patients are very sensitive. And so there is a non-hormonal option. Now, the non-hormonal option is fantastic. It's a great birth control. Usually that's not the go-to, because when we place the IUD, if I said that there's anywhere from 25 to 40% chance I can take that cycle away, versus that one where it contains no hormone, and I can tell you it's probably a good guarantee I'm going to make that cycle worse. Which one would you choose? I'm probably going with the one that would cause less bleeding in that regard.
I agree with you. But I don't know if it's because I'm a midwife. Okay. A lot of patients come in and they're like, I want no hormones. No hormones. So I have a lot of patients who ask for the copper IUD. It's very, very effective birth control. I don't know. Apparently, like copper is like kryptonite to sperm. Who knew? But we put them in. They're good for 11 years now, which is really nice for a lot of people who want something really long term. But it is not the birth control for somebody who came in and was already complaining about heavy, uncomfortable periods, because there is a good chance that it's going to make it worse. Yeah. Now, for somebody who really is like, I just don't want hormones, my periods are 2 days and really light, they may be a really good candidate for it. And then they're good for however many years. But you're right. Me personally, I take the hormones.
All right. Yeah. And so, that kind of lends into, choice in terms of which one would be best for you. The hormonal IUDs tend to have less bleeding, but I do want to touch on the aspect of why it's less bleeding.
Yeah.
And, I think some patients have the misconception that there's toxins and there's, flow that's building and that just never comes out.
That the uterus is just now all full of all kinds of,
it's all full of yuckiness.
It's a big concern for a lot of people.
I get it all the time. Patients say, isn't it natural to have a cycle? It is very much natural, but it is not unnatural for you not to have a cycle, particularly when it's hormone that is creating the aspect of you not having a cycle. So the way it works is essentially it prevents the lining of the uterus from building to the point that it sheds.
Right.
And so with that in mind, there's no buildup of anything problematic. It is just the aspect of the lining being very thin, so there's very little to shed. The key factor to that is that, Kerry, does that happen immediately after it's placed?
No. You do have to warn people that, when we first place these, people can bleed, and they can bleed for a couple of weeks. That bleeding gets to be less and less over time. But sometimes if you're not prepared to wait out those couple of sometimes months, it seems like it's never going to get better. But usually by the 3 to 6 month mark, you have significantly less bleeding. And, I know that you're the same, that an awful lot of these IUDs that we place, sure, they're good for contraception, but a lot of times we are using them to strictly stop bleeding. Yeah. And they really are an effective tool for that. All right. I like this one.
Okay. All right. You go for it.
So I have people ask me this all the time too, that, they know, IUDs are one of the best tools out there for young people or for young women who really have their whole lives planned, right? They're going to college and then they're going to get married. And then 2 years later, they want to have a baby. And then 3 years after that, they want to have their second baby. And I love that. But there is no tool out there that is going to help them do that better than an IUD. So a lot of times I have people come in and tell me their 5-year plan is to have a baby in 3 years. So why on earth would they be a good candidate for an IUD that's good for 8 years?
Right.
That doesn't make any sense to them. But do you put in IUDs that it's not going to be there for 8 years?
I put in IUDs. Really, my time limit and threshold is really just 1 year.
I agree.
If you feel like, hey, I'm going to hold off pregnancy for a year, then I think the IUD is a good fit for you for a variety of reasons. And again, there are other forms of contraception that are certainly suitable. But the really time factor, you take a pill every single day. Well, guess what? You got to go to the pharmacy, pick up your pills once a month in order for that to get going.
Yeah.
So it's consuming in a lot of ways. If you have other modes of birth control, this is far more efficient for your time and your energy at the same time. The secondary factor outside of the time and the efficiency is really the aspect of how effective it is.
Right.
You can't get any better than the effectiveness of the IUD. And then thirdly, it's the cost. The cost in terms of IUDs are probably equitable after a year's time, okay? Yeah. Meaning the aspect of picking up your pills, the cost of the pills and all of those things. So they're about on par after about a year point in time. So yes, you don't have to delay your fertility for 3, 5, 8, 10 years, depending on your IUD. Certainly you can come in. And the next question that really feeds off of that, Kerry, is that how soon does my ovulation return after my IUD is out?
And that is one of my favorite things about the IUD. If we're talking some of those other forms of birth control, I like pills. Don't get me wrong. There's a zillion of them on the market. I can probably find the right one for you, but you got to take it every day.
Yeah.
I am really good at taking my vitamins for like 2 weeks at a time. Like if I were dependent on that, I'd be in trouble. But with that IUD, and the other problem with a lot of those forms of birth control is it takes a long time to return to fertility. It takes a long time to get that ovulation back on track in a predictable way. For pills, you can be looking anywhere for 3 to 6 months. For Depo, you can be looking at a year. Same with the patch and the ring, again, great forms of birth control, but they take a long time to get that fertility, that ovulation back on track. IUDs, I tell people, like, you had better be taking your prenatal vitamins tomorrow if I'm taking this out today, because your return to fertility really is that quick for the vast majority of people.
100%. I agree with you, especially for that copper IUD.
Yes.
It does not affect fertility one bit at all. It does not do that. Again, that IUD works completely by barrier method. It prevents the aspect of egg and sperm from coming together. And so you better be ready tomorrow if you're getting your IUD. And so I tell patients, don't necessarily delay. If you feel like you can get pregnant tomorrow, that's when you want to have it removed. Then we should take it out.
That's exactly.
That's when you want to have it removed.
And not until then.
Right, not until then. Not until then. So there's no grace period in that regard. Okay.
That is another question that I get a lot. And it's actually, it wasn't submitted to us, but it's one I think I want us to address, is that people will come in and tell me stories about, friends of friends of friends, or even themselves, that they, had an IUD placed and then providers were reluctant to take them out. That they think that there's some sort of like special combination of words or some specific set of circumstances that they have to prevent with, or that their providers won't take these out. And I know you're the same, because it's that important to us that if somebody comes in and tells us they want this IUD out, we're going to take it out.
It's out.
I mean, don't get me wrong. If you're telling me that you want it out because there's a specific thing, and if I can fix that thing and you love everything else about the IUD, then I'll fix the thing. But if you want this IUD out, we will take it out.
Yeah, there's no pause in that.
No.
It should not be retained outside of your own wishes.
No.
Yeah.
All right. What else do we got?
All right. So we're going to break this down now to some things that we've heard or we've seen. These are common myths about IUDs, and we're just kind of going to dispel some of the myths that are surrounding IUDs. And so the first one is we've heard and we've seen that you can't have an IUD if you've never had a baby. Mm-hmm. So for moms who've never had a baby, do you think the IUD is a good choice?
It certainly can be, for all the reasons that we talked about before. Yeah. It's such a great tool for young women because they don't have to think about it while they're going to high school or college or whatever. Yeah. Placement is a little bit more challenging for them, but we will do everything we can to get them through it if that's what they want.
Absolutely.
But absolutely, they can have an IUD if they haven't had a baby yet.
Yep. And in the same line, IUDs, they do not cause infertility.
No.
That's not what they do. That's not what happens as a result of the IUD. IUDs do not cause significant scarring of the lining of the uterus that would prevent the aspect of pregnancy in the future. So infertility concerns is really not much of an issue. Now, it doesn't mean that everyone will get pregnant equally. Obviously, some patients have more challenges than others, but it's not due to the effect of the IUD in itself.
I read a study recently that they're actually thinking it might even help preserve fertility for some patients because it is actually inhibiting ovulation. That's one of the ways that it's working. So because we were all born with some number of eggs and that number goes down every month, but if you're not ovulating those eggs, the idea is possibly that we're saving those extra eggs.
That's right. That's for the hormonal
Not
IUD.
Suggesting it for that reason, but it could be a nice side effect.
Yeah, that's actually a good note. Probably needs some further investigation in that
Agreed.
regard. But again, that doesn't apply to the non-hormonal.
The copper IUD.
Yeah, the copper IUD.
The copper IUD would absolutely ovulate with a copper IUD.
Okay. Yep. We hear that IUDs are not effective.
I do hear that often. It's funny.
Or
when
my cousin got pregnant on the IUD.
Yes, with the baby holding.
With
the baby holding the IUD.
Yeah.
When we talk about birth control, there's two statistics, right? When we talk about how effective any birth control is, because there's the perfect use of any birth control. There's that statistic. So, by that statistic, birth control pills and so on are like 98.7% effective. But then there's the real life effectiveness, because everybody forgets their pills or everybody takes them at the wrong time or whatever. So like when you factor that in, the real life use of birth control is really somewhere more around like 87% effective. It's pretty similar to condoms. But with the IUD, you kind of remove that second part because there's only one use. There's perfect use or no use.
Right.
Like it's there and it's just going to stay there
right.
and continue to be effective. So they really are just across the board 98% effective.
Okay. Kerry, have you heard that IUDs cause cancer?
I have heard that. And it's not any more true for IUDs than it is for any other form of birth control. There is a very, very slight increase in your lifetime risk for breast cancer with any form of hormones. But truthfully, the increase that you have with any form of hormones, whether we're talking about birth control or hormone replacement later, is the same increased risk that you have if you drink red wine or eat red meat. So most people I know are already assuming that additional risk. So you might as well have a really effective form of birth control at the same time.
Yep. The next one, IUDs, do they increase risk of yeast infections and bacterial vaginosis?
The studies say no. And I don't feel like I see that clinically either. I think that, some people, I think it has more to do with hormonal shifts and some people being a little bit more sensitive to the lower level of hormone that you have with a hormonal IUD. But for those people, there are tools out there and we just got to manage that in a different way anyways. I don't think that the IUD specifically is responsible for those. What do you think?
The IUD, just given the understanding of actually how it works and the mechanism, the IUD, particularly the IUD that contains hormone, one way of which it works is at a barrier, of course. The second way is the progesterone that it contains. And progesterone in itself will increase cervical mucus and cervical discharge. And so oftentimes patients will come in and they think that there's a whole lot going on, but really it is the manifestation of the IUD.
Right.
And so we get that quite often where discharge and flow increases as a result of the IUD, but it's completely harmless, it's completely normal, and it's not anything problematic.
Right.
However, if you have symptoms that are consistent with a bacterial infection or a yeast infection, obviously you want to have that
Make
checked
sure that's
out.
treated.
Yeah, have that checked out. Okay. And so I think we went through most of our questions here, Kerry.
I think so.
And we'll go back to that first question. We'll make this the dad question of the day, okay?
Yes.
And so with that in mind for us, I think this is a question that I'll be happy to answer. Will my husband feel the strings of the IUD during sex? Now, if it's properly placed for you, the likelihood of that is pretty small. Most providers, what they'll do is they'll actually have you come back 6 weeks after placement. At that point in time, the bleeding should have settled and you should have been involved in some form or matter to determine whether or not that's a problem. Now, for a lot of my patients, I tell them, don't necessarily really prompt whether or not if they have a problem. Ask your husband.
That. Don't ask.
Yeah, don't ask. Don't
wait for them to bring it up.
Don't ask. It's like the military a little bit, all right? So, but if they bring it up and it's problematic, then that is a quick fix in the office. We have you come in. We can trim the strings to the point where it's not problematic and it's not going to be an issue for you. So in that regard, if it is a problem, it can be a problem, but it's easily managed.
It's also something that tends to get better over time because those strings tend to soften and tend to tuck up behind the cervix. So sometimes it's a problem initially that just gets better if we can wait it out.
Sure. And so...
Also, you're nicer than I am. I'm like, tough luck for that. Just kidding.
All right. So we'll end on that note. That concludes our our topic and our discussion. Hopefully everyone enjoyed the information and it was informative. But on to the next one.
Definitely.
Thank you for joining us on this episode of Stirrups. Be sure to send us your women's health questions and topics you'd like to cover by visiting our website, CarolinaEliteWomen.com. If you enjoyed today's episode, please subscribe to the podcast and spread the word by sharing it. To find out more information about Carolina Elite Women's Care, visit CarolinaEliteWomen.com. This podcast is edited and produced by Earfluence. Stay healthy and stay empowered. We'll talk to you soon on Stirrups.